Hi all of you. The preparation strategy for SS Super Speciality exam DM, MCH or DNB for 2022 session. See, my observation for last 6 months and especially last 2 to 3 months and after the results, and I have made couple of interviews with both the MCH and DM specialty toppers and also all the rank holders almost. And what I have observed and what is the essence and what is the output that I want to convey to you is, this will be a very important information to all of you. The information is that, how will I be able to get through specialty exam, super specialty exam in the year 2022? Either it be a NEET or NEET SS. My observation is and my opinion is that as of now, compared to these two exams, the most stable exam is NEET. I'll tell you why. I'll tell you the reasons. Because NEET and NEET has happened. Both the exams have happened. Observations based on the exams which have happened, and also the proposed exam which is going to happen in the upcoming NEET SS 2022. See, NEET exam which happened on 2021 December had close to, of 80 questions, had close to 55 to 60 questions on specialty and had 20 to 25 questions on the feeder branch. So it was very clear. So those people who prepared specialty, they got specialty question, and those people who prepared for general surgery or general medicine or general pediatrics or general OBG or pathology, whatever might be the feeder branch or anesthesia, they got say 20 to 25 questions from the feeder branch. Fair enough. So there was no problem, and people who prepared got the respective questions from the area of preparation and they attended, and the exam was a standard exam and the results were out and the process is over. Now this is very simple and straightforward. Now the observation on NEET SS 2021 session, which happened on January 10th and 2022, it was said to be the old pattern, in that 60 questions from specialty and 40 questions from general surgery. Of the 60 questions from specialty questions were there from the specialty books. Fair enough. The 40 questions are supposed to be from general surgery. 20 questions were from general surgery and 20 questions were not from general surgery. They are from pediatric surgery. And that too, in pediatric surgery, they are not of general surgery standard. They are been super specialty of pediatric surgery standards. So the paper was actually, instead of 100, the observation was only 80, because 20 general surgery question and 60 specialty question. So the general surgery part, for reasons not known, it has not been predictable and not been standard. The fear here is, if there is supposed going to be 150 question proposed pattern of NEET SS 2022, if suppose 150 questions are not coming from the said books of Bailey and Love or Subiston 21st edition, Bailey and Love 27th edition or Schwartz of 11th edition. Of these three books, generally students prepare for general surgery, correct? And even I take classes based out of these three books. Page to page, line to line, cover to cover, whatever the way we want to study, and all been done. But what if in 150 only 75 questions are asked from these three books of the knowledge or the outcome out of the three books, and rest of 75 questions are spread across few specialties or all specialties or specialty books? So there is going to be a discrepancy there. And you can ask me a question, sir, it's going to be the same for everyone, so it's not going to change much. But understand, there is a point you should note here. Those students who are preparing for a specialty exam like an NEET, they will at least prepare one specialty, yes, of specialty standard, and when they give the NEET exam, they will have an advantage of answering all general surgery questions and at least one specialty of a specialty standard. So, what I am trying to tell you is, the NEET SS to be standardized has to have at least one more exam in new pattern or two more exams in new pattern for that to be a stable exam for us to know to prepare based out of it. So, still it is in stage of evolution, means it has to evolve. We will not know what's going to happen. Tomorrow, if they are going to ask anything other than Bailey, Subiston and Schwartz in urology from Campbell, yes, and Sucklefold from Gastro, I'm not scaring you, and Graben-Smith from Plastic. So any of the specialty books they're going to ask you, you cannot go and question them. You cannot go and file anything against them. I mean, you cannot do anything. You have to just accept, because in medicine anything can be asked. And you have to be prepared for any questions to be asked. That's how it has been for last NEET SS 2021 session. And 20 pediatric surgery question was asked. You cannot do anything. You have to just answer. There is no criteria that the question should be only from these three books. There's nothing like that. So what I'm trying to tell you is, the safest method for upcoming NEET SS 2022, I'm not talking about the subsequent year, the coming exam in another 3 to 4 months, I request you, first you fix a specialty that you want to do. Do not prepare for SS just because everybody is preparing. Nobody does that way, but still, if you have that kind of a mindset, after the exams I will choose a specialty. Most of them don't do that, for whatever I have seen. Having said that, by this time you know what you want to do. Mentally you have fixed with the specialty. So that specialty that you have mentally prepared and that you want you to do, and you want to be that way, and in that specialty you want to acquire a super specialty degree and you want to practice in that specialty, prepare for that. Make your primary exam as NESS exam. This video will make more sense after both the exams are completed. That means NESS 2022 and NEET SS 2022. Make your primary exam as a NESS exam, because when you do that, you will prepare one specialty thoroughly. One specialty for sure thoroughly you will prepare, and that specialty is a specialty that you want to do your super specialty. So there's nothing wrong, because anyway you're going to read that. So prepare one, and general feeder branch, either be a surgery or a medicine or pediatrics or anesthesia or OBG, whatever the feeder branch you belong to and that you want to do and you have been doing, and that anyway you have to prepare. You prepare, because any SS will ask 30 to 40% of feeder branch other than the specialty. So you will prepare that as well. So once a specialty plus a feeder branch is prepared, and when you give the primary exam as an NESS exam, you will go all out to that standard of exam and prepare for that exam, and God willing, with your hard work and sincerity, you will be able to score a good rank. And why do you want to restrict yourself even before the start of the preparation? I will prepare only for NEET SS. See, preparation has to be one and multiple exam. That should be the concept. I'll repeat this once again. There should be one preparation, multiple exams. So you need to have more chances for your preparation. You cannot restrict yourself for one exam, irrespective of number of seats. Doing a super specialty in a central institute has a different destiny. Why do you want to lose that opportunity which exists just before? How you could decide yourself that my knowledge and my capacity is only for NEET exam, not for NESS exam? Why are you branding yourself? I mean, is there any system tells you that for your ability and your capacity, you can write only NEET SS and not NESS? Why are you thinking that way? Don't think that way. Any student who has completed a post-graduation or good enough and a deserving candidate to write any central institute exams. So don't give away your opportunity. prepare for one exam and write all exams. That should be your strategy. So NESS you prepare as a primary exam, I'm telling you, because that exam is going to come before the NEET SS. So NESS, you prepare, fix your specialty, what you want to do, read that specialty, nothing wrong about it. When you do your super specialty, you will not even have 1 minute or 10 minutes to read, take a book and read, I'm telling you. Because I have done super specialty. Any super specialty degree holder, post MCH or post DM, go and ask them, did they have time to read any of the super specialty books during their course? They cannot. Examination, when there is examination, there is a study holiday 1 month before, 15 days before the study holiday, they will allocate. Only that time you will buy the book. That is the fact, that is the reality. Because there will not be any time. You will be always in posting, always in the posting with the practice with the patient, and you will not have time to do that dedicated reading. Now it's an opportunity for you to do that. And it will give you a great mileage in your specialty period. Having a strong theory base and the book knowledge and application on your practice in the clinical practice will make a huge difference. And you will talk sense. People, when they say something, you will be able to correlate. So that opportunity you should not miss. So, fix your specialty, what you want to do, and just first you prepare for NESS. You are the most deserving candidate. Don't tell me, one student says, sir, I did my UG and PG from a private medical college. What are my chances of getting into NESS? Absolutely no way. It's a waste of time. I'll just read general surgery and go ahead and give an exam. Let whatever might happen, let it happen. That is not a right idea. That is a very bad idea. You are putting yourself down. The system of medical education in India is the same either in the government or the private college. There is no difference. The examination, standard of examination is the same. Is the standard of examination is different? And in different universities and different states? No. There will be a primary level of standard everyone has to clear and has to go to the next level, to the pass. It's not that easy. Correct? Everybody would have crossed that stage. So do not put yourself down and do not create yourself into an eligibility criteria. Don't decide by yourself that I will be eligible for this and not for this. Leave it. Step number 1. I've gone through all the phases. I know what it means. I'm telling you for your benefit. Understand this. First, prepare for NESS. Prepare for one specialty and a general feeder branch what you belong to. You have done it. Give a strong exam. Give with good faith. We give with good positive attitude. Definitely good results will come, I'm telling you. And even there is a problem after the results that the expected score has not come, then you will know where the deficiency happened. Based on that, you will have 1 or 2 months for you to correct before you go to the NEET SS. With the kind of a general feeder branch preparation that you have done for NESS will help you to write the entire NEET SS. And not only that, one specialty will be at your advantage. And you will have 15 to 20 questions out of 150 questions in your strong fold in case the question migrates out of general surgery to any of one specialty or multiple specialty. And you will be able to comfortably cross 50 to 65%, even a thick competition, and you will be at an advantage. And those students who are preparing for 2 specialties, NEET SS, you can write for 2 specialties, right? And if you can, one specialty I advise, in case you want to prepare for 2 specialties, prepare which are closely related. When you take general surgery, when you take people from MCH category, the best is to correlate with oncology because oncology is common to everybody. Surgical onco, surgical gastro, surgical onco, urology, surgical onco, vascular cardiothoracic surgery, yes, plastic onco, plastic endocrine head and neck. So you can choose which are common and allied. Similarly, in medicine, you choose cardiology or gastroenterology with any of the other specialties, where it will help you to score more number of questions and answer more number of questions in case if you want to do 2 specialties. First preference will be to do single specialty, but you have an intention to choose between 2, and if you prepare for 2, NEET SS will be a smooth sail for you because you will have read general surgery complete or general medicine complete or general pediatrics or OG or pathology or anesthesia, whatever your feeder branch, you would have read completely because you are prepared for an NESS. And the same with 1 or 2 specialties more is going to be a leading edge for this exam. Because I'll tell you one more thing, because the question paper and the question set is probably, I don't know, probably could be, the question setting could be given to post MCH and DM consultants. And I really doubt whether the people who are going to set this paper are only from MS and MD level. So if that is the level, and probably the questions could jump from general fetal branch level to a specialty level, and only the board has to decide on that. We don't have any clue about it. Only after the exams we will know what it is. So I always advise you, I summarize. I just leave it to you. It's my opinion, and if you want to follow, you can. And definitely this will be useful for you. That much I can tell you, that your primary preparation has to be for NESS. Prepare one specialty and thoroughly prepare for the fetal branch. And after that, NEET SS will come. Again, you have prepared thoroughly for fetal branch, and that will help you to appear for that exam as well. And if that exam has standard other than general surgery, your NEET SS or NESS will save you. And if you are able to score a comfortable rank there, in case you are not able to do there also, anyway you would have prepared for a fetal branch. With that you will be able to write the entire paper of the NEET SS 2022. And whatever the specialty that you have read for NESS, that will be an edge for you to score the maximum rank in that exam. Okay? So because there is no limit that they should ask only from these 3 books, we will not know. Only after the exams happen, we know. After the exams will happen, it will be late. It will be 5 to 6 months you have put on this process. That process should not go waste. And that day we should not come and discuss this. That's the reason why I am putting up this video. And you just go through this video, and if you are convinced with my discussion, you follow it, or else I leave it to you whatever the way you want to do. I wish you all the best and all the success for the preparation upcoming. Thank you. Bye-bye.